You might have seen patients coming around from theatre to recovery with an eye gel in and this breathing circuit attached to it. So what is it and why do we use it? This is a Mapleson E breathing system, and it's very, very simple, but it's very, very effective. And you need to know about it for the FRCA primary exam. It has three main components. It's got a fresh gas flow inlet. It's got an interface with the patient, either a face mask or it attaches to their supraglottic airway. And then it has a reservoir or exhaust tube. And here's how it works. When the patient breathes in, fresh gas from the fresh gas inlet and from the reservoir tube is inhaled by the patient. When they then exhale, during the expiration phase, they exhale into the exhaust tube or the reservoir tube. At the same time, there is still fresh gas coming in through the fresh gas inlet. And what that serves to do, because the patient is exhaling, it pushes this fresh gas flow this way into the tube. And that helps push all the exhaled gas with all the CO2 that you don't want them to breathe back in again, out the end of the tube. And then crucially, during the expiratory pause, so that brief pause between when they've finished breathing out and they take their next breath in, there's no gas moving in and out of the patient, but the fresh gas flow continues to flood into the system, and that continues to help push that expired gas out through the end of the reservoir tube, which means when they then take their next breath in, this reservoir tube is full of fresh gas, which is then fine for them to inhale, which is why it's called a reservoir tube, because it acts as a store of fresh gas from the previous expiratory pause for them to breathe in on the next breath. It's a very lightweight, simple and easy to use and effective way to make sure you're giving a good supply of fresh gas to your spontaneously breathing patient and making sure that they don't breathe any of their exhaled gas back in again. The key things to remember with this are, if a patient takes a deep breath in, you run the risk of them drawing air in from outside the expiratory tube if the tube is not long enough. So the volume of the tube has to be bigger than the tidal volume of the patient. So that volume in this tube needs to be bigger than any breath they're going to take in. So you just need to make the tube long enough for the patient. Secondly, you need to know the fresh gas flow required. So if you have a tiny fresh gas flow that's just trickling in, it's not going to push the expired gas out of the tube effectively. Likewise, if you put huge flow through, it's going to be wasteful because much of it's going to be lost into the atmosphere. So the ideal or necessary fresh gas flow is 2.5 to 3 times the minute ventilation of the patient. So however many litres the patient is breathing in and out per minute, you times that by 3, and that's the fresh gas flow required. If you are doing controlled ventilation, it's more efficient, so you don't need quite so much. You only need 1.5 to 2 times. If you're wondering how on earth this system can do controlled ventilation, it's a very simple manual method, which is if you occlude the exhaust tube, then the fresh gas flow will cause pressure to build up in this system, and you can actually increase that pressure enough to inflate the patient's lungs, and then you can release the pressure and the patient will exhale. The reason this is more efficient than the patient breathing in and out is because you as the operator have control over the expiratory pause and the expiration phases, which means you can control when they breathe out and when they take their next breath in. So you don't need as much fresh gas flow to make sure that this tube is full of fresh gas on the next breath in. But that's a bit more detail than you need for the exam. The main thing is it's very lightweight, it's cheap, it's easy to use, and it ensures a constant supply of fresh gas with no rebreathing. You just need to make sure that the reservoir tube is bigger than the patient's tidal volume.